Philippine Nurses Licensure Examination. Nursing Practice 3. Care of clients with physiologic and psychosocial alterations, Part A. Master your nursing practice 3. Let's start. Situation number 1. You are assigned to care for clients in the orthopedic ward, where many patients are recovering from fractures and joint surgeries. Pain management is a crucial part of their recovery. Question number 1. Mark is a 2-day post-operative client following an ORIF, open reduction and internal fixation, of the right femur. You notice that his leg appears swollen, pale, and cold to the touch. What is the most appropriate nursing action? Letter A. Apply ice packs to reduce swelling. B. Encourage Mark to move his leg slowly. C. Elevate the affected leg to improve circulation. D. Contact the doctor immediately. Answer. D. Contact the doctor immediately. Explanation. Swelling, pallor, and coolness of the limb post-surgery can be signs of compromised circulation, possibly indicating compartment syndrome. This condition requires prompt intervention to prevent permanent damage, making it essential to notify the doctor immediately. Question number 2. The physician ordered tramadol 50 mg PO every 4 to 6 hours for pain. If you administered tramadol at 3 p.m., when is the earliest you could safely administer the next dose if needed? Letter A. 5 p.m. B. 7 p.m. C. 8 p.m. D. 9 p.m. Answer. B. 7 p.m. Explanation. Tramadol can be given every 4 to 6 hours as needed. Since the initial dose was given at 3 p.m., the earliest safe time for the next dose would be 7 p.m., 4 hours after the last dose. Question number 3. During your assessment, you observe that a client with a recent femur fracture is quiet, avoids moving, and clenches their fists when you reposition them. What does this behavior likely indicate? Letter A. The client is adapting well to the pain. B. The client is experiencing significant pain. C. The client has become unresponsive to pain. D. The client is ready for discharge. Answer. B. The client is experiencing significant pain. Explanation. Clenching fists, remaining quiet, and avoiding movement are common behavioral indicators of pain. Recognizing these nonverbal cues helps nurses to address pain management needs appropriately, even if the patient does not verbally express discomfort. Question number 4. Pain perception in orthopedic clients may be affected by various factors, including anxiety and fear. Which nursing intervention could help alleviate these influences on pain? A. Encourage deep breathing exercises to reduce anxiety. B. Administer pain medication immediately. C. Limit family visits to allow the client to rest. D. Keep the room lights dim at all times. Answer. Letter A. Encourage deep breathing exercises to reduce anxiety. Explanation. Anxiety and fear can amplify pain perception. Teaching relaxation techniques such as deep breathing exercises helps the client to manage stress, which can, in turn, reduce the intensity of perceived pain. Question number 5. Your client has an epidural catheter for pain management following spinal surgery. What is your priority nursing action to ensure the client's safety? Letter A. Monitor the client's respiratory rate and level of sedation. B. Keep the client in a high Fowler's position. C. Apply heat to the client's back to promote circulation. D. Change the catheter's side dressing every 2 hours. Answer. Letter A. Monitor the client's respiratory rate and level of sedation. Explanation. Monitoring respiratory rate and sedation levels is crucial because epidural analgesia, especially opioids like fentanyl, can depress respiratory function. Assessing these parameters helps prevent potential complications from opioid-related sedation or respiratory depression. Situation 2. In the OR, patient safety and preparation for surgery are of utmost importance. The OR nurse is responsible for confirming and ensuring all preoperative checks are complete and protocols are followed to optimize surgical outcomes. Question number 6. To ensure proper identification and consent, which item must be verified as soon as the patient arrives in the operating room? Letter A. Type of anesthesia. B. Allergy history. C. Operative site and patient identification. D. Equipment setup. Answer. C. Operative site and patient identification. Explanation. Confirming the operative site and verifying the patient's identity is critical to prevent wrong site surgeries, ensuring safety from the beginning. Question number 7. To prevent hypothermia in patients during surgery, the operating room nurse should prioritize which of the following measures? Letter A. Raising the operating room temperature. B. Keeping the patient covered with warm blankets. C. Using high-flow air warming devices. D. Restricting the use of air conditioning in the operating room. Answer. B. Keeping the patient covered with warm blankets. Explanation. Covering the patient with warm blankets minimizes heat loss and is a recommended protocol to prevent perioperative hypothermia. Question number 8. In cases where a patient may aspirate during induction, what is the operating room nurse's immediate action to reduce this risk? Letter A. Place the patient in a Trendelenburg position. B. Administer antiemetic medication. C. Confirm that the patient is fasted according to guidelines. D. Position patient supine with no head elevation. Answer. C. Confirm that the patient is fasted according to guidelines. Explanation. Fasting is essential to reduce the risk of aspiration. The OR nurse verifies that the patient has followed preoperative fasting instructions to minimize gastric contents. Question number 9. Before positioning a patient for surgery, which of the following is crucial for the operating room nurse to assess? Letter A. The patient's height and weight. B. The surgeon's preference for patient positioning. C. The patient's musculoskeletal condition. D. The location of the anesthesia equipment. Answer. C. The patient's musculoskeletal condition. Explanation. Assessing the patient's musculoskeletal condition is crucial to avoid nerve damage and discomfort, especially if the patient will remain in a particular position for an extended period. Question number 10. A patient in the operating room has a documented allergy to latex. Which of the following is essential in the operating room setup to prevent an allergic reaction? Letter A. Use of only sterile supplies. B. Avoiding the use of drapes. C. Using latex-free gloves and equipment. D. Placing the patient in a separate or suite. Answer. C. Using latex-free gloves and equipment. Explanation. For a patient with a latex allergy, all latex products must be removed or substituted with latex-free materials to prevent an allergic reaction during surgery.